Cancer is the second leading cause of death worldwide, and it strikes fear into the hearts of many. But early detection can be a powerful ally in the fight against this formidable foe. In this video, we'll be uncovering the 12 vital signs of cancer that you need to know. Stay tuned to the 11th and 12th signs, as it is one of the surest ways to detect cancer. Number 1. Chronic fatigue. When coffee or enough sleep is not working, can sometimes be an early warning sign of certain types of cancer. The body's immune response against cancer can consume considerable energy reserves, leading to persistent fatigue. Tumors can release cytokines and other molecules that induce fatigue as part of the body's response to the disease. Cancer cells often exhibit a phenomenon known as increased glucose metabolism, or the Warburg effect, where they consume glucose at a much higher rate than normal cells. This means cancer cells can take in up to 10 times more glucose than normal cells to support their rapid growth and proliferation. Moreover, this increased glucose uptake by cancer cells can lead to higher levels of lactate production, even in the presence of oxygen, aerobic glycolysis, which is a characteristic metabolic feature of many cancers. This metabolic reprogramming not only supports the survival and growth of cancer cells, but also contributes a decline in surrounding organ function and also chronic fatigue. Cancers that affect the bone marrow, such as leukemia or lymphoma, can lead to anemia, a condition where there is a decreased number of red blood cells to carry oxygen to tissues, resulting in fatigue. Similarly, cancers that affect hormone levels or metabolism, such as thyroid cancer, can also contribute to feelings of tiredness and lethargy. Number 2. Chronic pain. Chronic pain can be a crucial indicator of underlying cancer, depending on its location and nature. For instance, deep, persistent pain in the bones that does not change with body position, particularly in the back, hips, or legs, could suggest bone metastasis from cancers like breast, prostate, lung, or kidney cancer. Abdominal or pelvic pain that worsens over time, accompanied by symptoms like bloating or changes in bowel habits, might signal ovarian, pancreatic, liver, or colorectal cancer. Headaches that persist despite standard treatments, especially if accompanied by neurological symptoms, could indicate brain tumors such as gliomas or metastases. Similarly, chronic back pain that doesn't respond to rest or usual treatments may be linked to spinal or nearby organ cancers like lung, breast, or kidney cancer. In women, persistent pelvic pain combined with abnormal bleeding or changes in bladder habits could point to gynecologic cancers, like ovarian, cervical, or uterine cancers. Other types of pain, such as unexplained chest discomfort, chronic sore throat, persistent muscle pain, or the presence of space-occupying lesions that cause pressure on nerves or organs, might also be indicative of cancers such as lung cancer, throat cancer, or soft tissue sarcomas. Number 3. Difficulty swallowing. Difficulty swallowing, medically termed dysphagia, can be an alarming symptom that warrants attention, as it can sometimes indicate underlying cancer. When cancerous tumors develop in the throat, esophagus, or nearby structures, they can obstruct the passage of food or liquids, leading to difficulty swallowing. This symptom may start gradually and worsen over time, often accompanied by pain or discomfort while swallowing. Esophageal cancer, for example, commonly presents with dysphagia as a prominent symptom, particularly as the tumor grows larger and obstructs the esophageal lumen. Similarly, throat cancers, including those affecting the larynx or pharynx, can cause narrowing of the throat passage, making swallowing challenging. It's important to note that difficulty swallowing can also result from non-cancerous conditions such as gastroesophageal reflux disease, esophageal strictures, or neurological disorders. However, persistent or progressive dysphagia should always prompt further evaluation by a healthcare professional to rule out or diagnose potential cancers early. Number 4. Mouth bumps or lesions. Changes in the mouth, such as the development of unusual bumps, persistent sores, or lesions that do not heal, can often be indicators of oral cancer. This type of cancer can arise in different parts of the mouth, including the lips, tongue, gums, roof, or floor of the mouth and inner cheeks. These symptoms may initially appear innocuous, but can progress if not addressed promptly. Oral cancer typically presents as non-healing ulcers, or sores that may bleed easily, and fail to improve with usual oral hygiene measures. Number 5. Persistent low-grade fever and night sweating. A persistent low-grade fever refers to a mild increase in body temperature, often slightly above the normal range, 98.6 degrees Fahrenheit or 37 degrees Celsius. This fever typically persists for an extended period, usually weeks to months, without an apparent cause, like a cold or infection. In cancer patients, this fever can occur due to the immune system's response to the cancer cells, or as a side effect of certain cancer treatments. The body's immune response to cancer can lead to the production of fever-inducing substances such as pyrogens, causing both fever and sweating. Night sweats, characterized by excessive sweating during sleep, are often associated with underlying medical conditions such as cancer. In cancers like lymphoma and leukemia, night sweats can occur due to various factors. Firstly, cancer cells and immune cells release cytokines such as interleukin-6, which stimulate the body's thermoregulatory centers in the brain, leading to increased sweating. Hormonal changes, particularly in cortisol and adrenaline levels, may also contribute to night sweats in cancers, affecting hormone-producing tissues. Number 6. Flatulence or bloating. Flatulence or bloating, although sometimes might be caused by other factors, can sometimes indicate cancers like ovarian cancer. Persistent or unexplained bloating, coupled with abdominal discomfort or feeling full quickly after eating, warrants attention. Ovarian cancer can cause these symptoms by affecting the abdominal cavity, leading to fluid accumulation, ascites, and pressure on the stomach and intestines. This can result in a feeling of bloating or even visible abdominal distension. Number 7. Wounds that does not heal. Wounds that do not heal can sometimes be a sign that your body's resources are being diverted to fight an underlying health issue, including potential cancer. Normally, our bodies are adept at healing wounds within a reasonable time frame. However, wounds that persist, worsen, or reopen despite appropriate care could indicate a deeper problem. Cancerous cells can hijack the body's resources, diverting them from normal healing processes. This diversion can weaken the immune response locally at the wound site, leading to delays in healing. It's important to monitor any wounds that are slow to heal, especially if they are in areas that are not typically subject to prolonged healing times, such as small cuts or abrasions. If you notice a wound that doesn't seem to be getting better over several weeks, or if it shows signs of infection, it's essential to consult with a healthcare professional for proper evaluation. Number 8. Chronic cough. While a cough is a common symptom of respiratory infections or allergies, a persistent cough that doesn't resolve with typical treatments, like over-the-counter medications or antibiotics, could signal an underlying health issue. While coughs are commonly associated with respiratory infections or allergies, when they persist, especially for more than a few weeks, it may indicate a more serious condition such as cancer. Cancerous tumors in the lungs or nearby structures can irritate the airways, leading to ongoing coughing. The tumors can obstruct or inflame the air passages, triggering a chronic cough as a prominent symptom. This cough is often persistent and may worsen over time. Moreover, cancers like lymphoma or metastases to the lungs can also cause chronic coughing. Lymphoma can affect lymph nodes in the chest or even the lungs themselves, leading to coughing as a result of enlarged nodes or direct lung involvement. Metastases, which are cancerous cells that have spread from other parts of the body to the lungs, can similarly impact lung function and cause persistent coughing due to their presence and effect on lung tissue. Number 9. Changes in excretion. Changes in excretion especially. Urine can be a sign that something is amiss. This includes seeing blood in your urine, which can appear as a red or brown discoloration. Even a small amount of blood that might not be visible to the naked eye can be detected through tests. This condition, known as hematuria, is one of the most common early signs of bladder cancer. Experiencing pain while urinating, an increased frequency of urination, or a sudden urgency to urinate even when your bladder isn't full. While these symptoms can be associated with less serious conditions, like urinary tract infections, persistent changes should not be ignored, as they can also indicate cancer, most notably bladder and kidney cancer. Painful urination is another symptom to be mindful of. It might feel like a burning sensation or sharp pain, which can be associated with infections, but also with tumors pressing on urinary structures. Persistent diarrhea or constipation that doesn't respond to usual treatments can be a significant indicator of a potential problem, including cancer. These symptoms could suggest issues like colorectal cancer, especially if they're accompanied by abdominal pain. It's crucial to pay attention to the appearance of your stool. Black tarry stools might indicate bleeding in your upper digestive tract, while bright red blood can suggest issues in the lower tract, possibly pointing to colorectal cancer. Even a change in stool shape, such as consistently thin stools, can be a sign of a blockage or growth. Number 10. Unexplained weight and appetite changes. Unexplained weight loss is particularly concerning when it occurs rapidly and without changes in diet or exercise. For some cancers, such as pancreatic stomach, esophageal or lung cancer, weight loss can be an early sign. Cancer cells can alter the body's metabolism, leading to a state where the body burns more calories than usual, even if food intake remains constant. This can result in unintended weight loss, which may be a sign that cancer is affecting how the body uses energy. Conversely, some cancers can cause weight gain or changes in appetite. For example, ovarian cancer can lead to abdominal swelling or bloating, which may cause an increase in weight. Changes in appetite, such as a loss of interest in food, feeling full quickly after eating small amounts, or experiencing unusual cravings, can also occur with certain cancers affecting the gastrointestinal tract. Number 11. Lumps in the skin. Feeling lumps in your skin, whether on your arms, legs, or torso, can also be an indication for cancers. Women are highly encouraged to do self-examination on their breast regularly, and if you find a lump that could indicate cancer, but don't be alarmed, as most of the time it is benign, meaning they are non-cancerous growths. That can include fibroadenomas, cysts, or benign tumors like intraductal papillomas. These benign conditions are common and may cause similar symptoms as cancerous lumps, such as pain, discomfort, or changes in size. While benign breast lumps are generally harmless, any new lump or change in your breast tissue should be evaluated by a healthcare provider. Number 12. Changes in the skin. Changes in the skin, such as the appearance of new moles, warts, or melanoma, can sometimes indicate underlying issues related to cancer. Melanoma specifically is a type of skin cancer that develops from pigment-producing cells known as melanocytes. It often presents as changes in the size, shape, color, or texture of existing moles, or the appearance of the skin. Skin changes associated with cancer can include moles that grow larger, become asymmetrical, or develop irregular borders. They may also vary in color, ranging from dark brown to black, or exhibit multiple colors within the same mole. Itching, tenderness, or bleeding of moles should also be noted, as these can be signs of potential malignancy. Bruising or easy bleeding of the skin, especially without any apparent injury, can also be indicative of certain types of cancer, such as leukemia or other blood-related cancers. These cancers may affect the production and function of blood cells, including platelets, which are essential for normal blood clotting. And here are the 12 vital signs of cancer. It's important to stay vigilant with the signs. Millions of people are affected by cancer without realizing it. By familiarizing ourselves with the signs and symptoms discussed today, we can tip the odds in our favor. Remember, early detection saves lives. If you like this video, don't forget to like and subscribe for more, and we will see you in the next video.